So just a little recap for the maxillary arrangement. You want to make sure that whatever arch form you created, that it's very similar to the arch form of the cast, which should be the same as the patient's face form. And hopefully you've ordered the appropriate tooth mold to match that patient. Okay? We're ready to move on to our lower posteriors. And typically I'll start on the third quadrant. Again, being right-handed, it's a little more convenient for me to work on this side versus the fourth quadrant. So at this point, we can take our setup plate off. Don't disregard it. You might have to come back to it. And then we can reintroduce our lower bite block. This is the bite block that we had from our bite registration appointment. And if I close it, you can see that the pin is touching with the incisal plate or incisal table. The pin is at 0 and pretty much mimics the plane of occlusion that we had before. So no surprise here. I'm going to remove the mandibular cast off the articulator, just a little easier to work with. And I can, again, remove all of this occlusal rim off the base. Just to make it a little bit easier to set up the teeth. Do it in a way so you don't have to destroy the periphery. So you don't have to go back and do that again. So just go at it in little increments. And I think if you do it on the master cast, it's a little easier and certainly a lot safer to cut through the occlusal rim. So remove as much wax as possible so you don't have interference with setting up the teeth, but try to preserve the periphery of the occlusal rim, which eventually will turn into your trial base as part of your wax up to be tried in. Just going to take a little care here to make sure that the wax is sealed again. Do it now because it's going to be a little more challenging to do this when you have the teeth in the way. So kind of working from the bottom up, so to speak. Just heating up my spatula and just utilizing the existing wax that's there to kind of seal things nicely. So we don't have any blanching of the wax. Because after our setup, we're going to be adding layers and layers of wax on this to build it up and finalize our wax up to mimic the soft tissue and the underlying bone. All right, that looks pretty good. And of course, we're going to seal our base plate to our mandibular master cast. But before you do that, just have a final look. Make sure there's nothing on the underside here that might prevent the base plate from sitting on the master cast as it should. Okay, just give it a good firm and seal it. Usually I try to seal it in about 4 little spots. Buccal and labial vestibule somewhere in the middle. to stabilize it so it's not moving around as you're working through your tooth arrangement. Okay, this can go back onto our articulator. And we can start thinking about setting up the lower posteriors. Like I mentioned before, I'm going to start with the lower third quadrant posteriors, and I'm going to start with the first molar. And sometimes you might even want to start with the second premolar. So try both ways, see which one works better for you, depending on the mold or the brand of the tooth. Some work better by starting with a first molar, and some work better starting with a second molar. Just remember the posterior, lower posterior teeth are about half a tooth offset, so they're slightly anterior to the maxillary posterior teeth. Okay. So the mesial buccal cusp of 3/6 will fit in between the interproximal of 2/6 and 2/5. Or if you're starting with a second premolar, it will fit between the interproximal between 2/5 and 2/4, and so on. So they're about half a tooth offset. Now this is quite a bit of a gap here that we need to fill. So if we take wax from our Bunsen burner and trying to drip some wax on there, it'll take us a long time. So another way that you can work around this is to get some base plate wax and just form a little strip. Just trying to get some base plate wax here. Thank you. So you can take a little bit of base plate wax, and I'm just going to heat a little bit over the Bunsen burner. You don't need a lot, just a couple of rolls. I'll cut that off, and you can fold it again. And I'm going to position that over the crest of the ridge here. And cut off a little bit of the excess. All I'm going to concentrate, all I need is enough wax there to set up the posteriors. Make sure you seal this piece of wax to the rest of the base. Just trying to position the camera a little bit better for the class. So nothing moves around. Everything is nice and secured. So I can close the articulator and see where the first molar will be situated. So it looks like it's going to be somewhere in here, somewhere in there. So I can heat up an instrument. I like to use my surgical knife because it doesn't displace the wax, it just heats it up. Mind you, it's going to take you a little bit longer than possibly using a font stock, but it maintains the position of the wax a little bit better. Okay, so I'm going to start with the molar, first molar. And if we've done the maxillary posteriors correctly, this central fossa should line up with the crest of the ridge. But let's just see. slowly bring it together. Until we have a very nice tight centric and we see the pin close again. So that looks pretty good. So once again, this tooth is offset by about half a tooth or so. So it's just interior to the maxillary molar, first molar. It looks like it's in good tight centric, but there's a lot of wax there in the way to assess it properly. So I'm going to cut a little bit of the excess here. And a little bit on each side. I'm going to soften up this wax and try to position this tooth a little more towards the lingual. It looks pretty good, but in terms of the overjet, the horizontal overlap between the top and bottom teeth right here, I need to create a little more. So I'm going to heat up the wax around this tooth. It looks like it's in great alignment in relation to the ridge. And just take the time to heat up the wax evenly throughout the tooth or around the tooth to make sure the tooth moves the way you think it's going to move. Otherwise, if there's a cold spot in there, it's going to pivot around that cold area of the wax. So I'm just going to push it towards the lingual about 1/2 millimeter or so. Bring it back together. And it should intercuspate beautifully. Okay? Just like that. Looking at it from an occlusal view, just going to rotate this a little bit. It looks like I'm in line with the crest of the ridge and the central fossa being in line with the crest of the ridge. So far so good, and I can continue to my second premolar. This case that we're working on, it's designed in the sense that you don't have to do a lot of reduction on the lower posterior teeth. I'm sure you have plenty of opportunity of reducing teeth or reducing base plates to get them to fit. We just want to concentrate on getting a balanced occlusion eventually. So I'm going to introduce the second premolar now into the tooth arrangement. Utilize the existing tooth that I have there. Maybe leave it slightly higher and bring it together and see how everything fits. And that fits rather nicely again. I'm looking at the buccal slope angle between the 6 and the 5, and that looks very similar. We'll take a closer look under the document camera a little bit later on, but so far it looks pretty good. And again, this does not happen unless you've taken a great deal of care to make sure that the maxillary lingual cusps are centered over the crest of the ridge, as well as lining up the central fossas, marginal ridges, creating the proper angles in relation to the occlusal plane, and of course proper rotation of the teeth. I'm going to continue with my first premolar now. Make sure that you don't have wax between the contact areas of adjacent teeth, because that will create diastemas and it will have an effect on centric occlusion and of course balanced occlusion as well. Let's see how that comes together now. Another successful position. Doesn't always happen like this. But I think as you work through cases and you do more and more, the tendency is to have this result most of the time. So I'm going to close it back together in centric, and all I'm looking for right now is just a nice tight centric between upper and lower occlusal surfaces. This one looks it's a little bit short, so I'm going to see if I can pry it into position. That's pretty good for now. I'm not going to spend a whole great deal of time on this one now. And looking at it again from an occlusal view, it looks like all my central fossas are in line. And I'm establishing a very slight buccal curvature, just like we had with the upper. So finally, we're going to introduce our second molar. And if you selected a proper size for the posterior teeth, the second molar will terminate just before the incline of the mandible. So nothing should be on the incline. Posterior teeth should be positioned on the flat portion of the ridge, or at least the horizontal portion of the ridge, I should say. Okay. Second molar. I'm going to use the first molar as a guide. And see how this comes together. That turned out pretty nice. It's still short of a nice tight centric contact, so I'm just going to lift this tooth, and I'm going to do the same thing with the first molar as well. Seal the wax around the tooth. Bring everything into centric occlusion, and once we're satisfied with centric occlusion, we are going to move our articulator to simulate working and balancing contacts. Just take a little time to seal things together here. So I typically leave the tooth maybe just slightly longer where I need to, in terms of the height. So the opposing tooth guides it into the right centric occlusion. It's still not there, so I'm going to lift it up a little bit, and this one here too. Just be careful not to over-rotate the teeth if you happen to move them around. This one here as well. And bring everything into a close. And that looks pretty good. So we'll take a closer look at this before we start assessing our working and balancing. So what we have here, we have the upper and lower posterior teeth, at least on the second and third quadrant, in a very tight centric occlusion intercuspation with a horizontal overlap, meaning that there is a difference. The upper teeth are overlapping the lower teeth in a horizontal sense about 1 millimeter to about 1.5 millimeters. So the cusp ridges of the upper posterior teeth are buccal to the lower cusp ridges of the posterior teeth. And this is nature's way of displacing the cheeks away from the occlusal table so we don't bite our cheeks, right?